I had a brief conversation, well, I had a number of really interesting conversations during the break. One of them was with one of CareOregon's own CHIA members who basically said, one of the most wonderful things about serving is what it's done for me. He says, look at me now and think about where I was when I first came to this group. It's really made a difference in who I am. So there's a benefit that sometimes we don't even think about. But now I really want to introduce you to Bryant Campbell. He's another patient advisor who gives generously of his time and energy to improve our healthcare system. He served for 2 years as a patient and family advisory council member for the Providence Medical Group and is also a manager of the state of Oregon. So he brings the unique perspectives of a patient with chronic illness that's served by the new model of the medical home. And he also is a member of the Public Employees Benefit Board, a board that's really making an effort to positively impact the care and the cost to thousands of public employees for their health care. Now, Bryant, over the past 2 years, has used his public speaking and presentation skills to share his knowledge and experience about the medical home and what it means to be in a patient-centered care environment. He does this in conferences, seminars, publications, interviews. Basically, Bryant believes in the value of the story. He's not only willing to speak, but he really enjoys sharing his story and contributing the voice of patients wherever he gets the opportunity. So please welcome Bryant Campbell to talk to us about patient medical systems.
Good morning. This was a lively group at the break, so don't go to sleep on me now, folks. Thank you for the introduction. I appreciate that. I'm not a member of the benefit board. However, I am a public employee and manager for the state of Oregon, so my benefits come through the benefit board. So I'm not a member of the PEB benefit board. Just wanted to clarify that because that's a dangerous role to have. I don't want anyone coming to me afterwards saying, so what happened to the state employees' benefits and why did they get this or aren't getting that? So just for clarification. But good morning again. It's my privilege to be before all of you this morning and to speak on behalf of our illustrious group at Providence, the Patient and Family Advisory Council. This is good conversation. It's good information, and it's one that I think is very worthy of the time that everyone's spending here today. And I recognize that it's just, we all take our time and our energy and all of our efforts in order to be at a function like this. And it's been a great effort by those who put this on, and so we should thank all of them for that. But I'm here today again. I do take great pride in the value of sharing a story. And so that's what I'm going to do today, really, is just kind of share my story and my experience. First of all, I've been a Providence patient for the past 13 years. And though the majority of my time as a patient was spent being fairly healthy, I would say, I got a few weight problems, but fairly healthy, I had what I explained to be a when I need you relationship with my provider. Now think about that. One of the most important relationships that you have should never be based on when I need you, whether it's your marriage or whether it's with your children or even with your clergy. Whoa, was that me? It should never be based on when I need you. But that all changed over 2 years ago when I found myself experiencing symptoms unlike I had ever felt before. And I went from feeling really healthy, energetic, and vibrant to being tired, sluggish, and really in pain all day long. I went from barely knowing my doctor, now remember it was when I need him, so barely knowing my doctor and seeing him every once in a while, or when my wife said, did you get this checkup or did you get that? Have you gotten your flu shot? Go, go, go. From that type of relationship and seeing him every once in a while to visiting my clinic weekly or more times than one during the week, trying to not only figure out what was wrong with me, but also trying to figure out how to articulate my symptoms in a way that I didn't show my panic and in a way that I didn't show my fear, and how to explain exactly how I was feeling to them And really, inside, the best way that I could explain it was really to simply tell him that I feel like I'm dying. I know my body. It isn't doing the things that I know it can do and that I want it to do. And I simply just wanted to yell out each time that I went in there, help me, I feel like I'm dying. And so as a patient, we have to recognize that, we know a lot about ourselves. We kind of go in with an expectation that they know a lot about us, but again, it's on that when I need you type basis. And so that relationship doesn't work when it's set up like that. And so I went from barely knowing my doctor again to kind of seeing him on a daily basis and tell him, kind of feeling like, I'm dying. I don't know what's going on here. And as providers, it's also important to know that when you see us as patients, that no matter how well educated we are, or what socioeconomic background we come from, or how nice we may appear to be, you never, ever, ever see us at our best. Because when we're at our best, we aren't sitting in your waiting rooms. Because we have a lot more important things to do than to just sit there to say, hey, how's it going, Dr. Thompson? Providers don't have the time for that, and nor do we as patients have the time for that. We have busy lifestyles just like everyone else. But that being said, I'll tell you that I had gone through a situation, and I'll never forget that day. And it's hard to describe what that day is, but when you're sick and you're seeking answers and you're in pain, you're looking for that day, and it's the day you get the answer. You don't get the good news, you just get the answer. So the good news is that it's all gone away and you're 100% better and something just happened and it's passed. But no, not for me. In my situation, I just got the answer. And I felt like I had been poked and scanned, x-rayed, touched, probed, made to feel like I was crazy. And at one point, I had even been questioned about the medication consumption that I was taking. Why was I coming back so often? What did I want? I had a doctor ask me, well, you got Vicodin. What else do you want? I didn't want the Vicodin. I wanted the answer. I wanted to know why I was feeling the way that I was feeling. And I wanted to know how is it that we could change that so that I could get back to myself. Because I didn't recognize this person. I didn't know what was going on. So after going through all of this stuff, one of these days I was en route to yet another appointment for some additional testing. And as I'm driving down the road and thinking about the possibilities of what this could be and what was going on, my phone buzzed. And I looked down at it. I remember it as though it was yesterday. I looked down at it on my dash and I recognized that it was a Providence number, and so I answered it. And it was my doctor. And so I pulled over, I answered the phone, and I'll never forget hearing his voice when he said, Bryant, we figured it out. We figured it out. And so after catching my breath, as we do when we're looking for the answers to something that we feel is going to be very serious, I pulled over and I caught my breath. And I said, okay, so what is it? Tell me about it. And I thought, what an interesting place to find out something that could be and probably will be life-changing for me, to find that out in the parking lot of a Burger King. Not that that's really significant, it just so happened to be where I was at that time, but I do remember thinking about it. And my doctor told me what was going on with me, and he said, so this is what I want you to do. So I was told to not go to that appointment that I was going to cancel that appointment, and I was given a phone number of a specialist and told to call and make an immediate appointment. And I remember hanging up the phone and taking a deep breath, and although I was a little bit panicked, I still felt okay. I had the answer, and maybe they were going to help me out. And so I decided to define that as day one of the rest of my life, because I was told that I was now going to be living differently. So shortly after that, my doctor recommended an opportunity to me. I was at an after visit with him, and we were visiting, and he began to share with me how grateful he was that I was my own best advocate, and how much better off I was going to be because I continued to challenge him and the healthcare system to figure out what was going on in my life and with my health. And my doctor says that he had been in a staff meeting and the office manager had asked them to take a look at the patients and make recommendations of anyone who could be a candidate for this new advisory council that Providence was developing. He didn't have a lot to share with me about it, and he didn't really know a whole lot about the process. However, he did give the information to me, and he made me feel good about what he thought I could contribute. So I decided to view it. And now I've served in that patient and family advisory role for 2 years, and it's one of the most important roles I think that I serve. So the past 2 years have been amazing. There have been so many value adds to being a part of this group that sometimes when you think about it all, you become emotional and kind of moved to tears as we see today. You know, at the beginning of this, I questioned my values, questioned the motives of Providence for creating such a group, and I questioned whether or not I would have really any real impact. And what I can tell you is that I've been fulfilled on so many levels. Joining this group has not only do I feel valued, but it's made me a better patient, a better resource to others, and overall a better human being. It's amazing to see at these meetings how intensely the leadership at Providence listen when we speak. There are times where the leadership actually goes quiet and they have this kind of awestruck look on their faces when the members begin to talk and when the members begin to question and challenge and give open and honest feedback. It's empowering to see the leaders not only want to hear from us, but they also engage and they react, and that's important. The Providence leadership is transparent and at times vulnerable as they take a risk in valuing the fact that as consumers of healthcare, we do know what we want. We know how we want it, and we know when we want it. And they've shown us that they not only value us as patients and consumers, but they value our communities, our beliefs, and our experiences. We've had a lot of opportunities to contribute to a lot of projects within our group. And about a year ago, our advisory group received an innovation grant that we all decided to utilize as a resource and to resource a way to communicate the message of patient-centered medical home to patients of Providence. So I was involved in this from its inception to meeting with the creative vendors to the final product. So part of that, that product today I'm going to show you because we're very proud of what we came up with. Be prepared to be wild, folks.
It takes a lot of patience to be a patient. Like say you need something really simple. You can't just fire off an email. Nope. You gotta call the office, get put on hold, find out you need an appointment which won't be available for 5 days. And when it's actually urgent, your doctor is always booked solid, so you have to wait or see some other doc who knows nothing about you. It's even worse when you need something beyond primary care, because then you've got a lot of people talking about you and your health, but not talking to each other. Like we said, it takes a lot of patience being a patient. The people at Providence Medical Group are making this better with the patient-centered medical home. We know it's a mouthful. We'll call it PCMH from here. PCMH is a new team-based approach to your healthcare. You'll be assigned an entire team of healthcare professionals committed to your care, from the slightest cold to the more serious stuff. At the core of your team is the care coordinator. Anytime you call or email, no matter what you need, they make it happen. And yep, you heard right. You can call and email them for the stuff that doesn't require an appointment. If you happen to need any type of care outside of the normal stuff, they'll also make sure that everyone involved is on the same page. In addition to your primary care doctor, your team includes other medical providers such as physician assistants or nurse practitioners. This means you can always get an appointment when you need one with someone you know and who knows you. And the final member of the team is you, because after all, it's your health. With Patient-Centered Medical Home by Providence, it takes a lot less patience to be a patient.
What a great tool to be able to share with patients and to know that the voice of patients went in the creation of this. This short video is also being translated into 4 additional languages. And so it's broad. It's going to cover a wide base of the patient community within Providence. And it's just a great tool. I think what's really important to know about this project is not only that it's simply just a great project and it turned out to be a great video, but the fact that Providence showed their value in patience. They trusted in the collaborative process. And when you take trust in that process and in the patients that you serve, that you can come out with a product that is not only useful to the healthcare community, but it's also a great resource for other patients. Now, as we embark on historical landmark changes in healthcare around our country, I think it's important that we as patients never lose our voice. Being an advisor has shown me that there's power within sound and visibility. And I want to continue to challenge myself as other patients should challenge themselves in taking a look at the big picture of healthcare. Because really it's about access, it's about better care, better treatment, better choices, better policies and regulations. Really, at the end of it all, it's all about us, it's about patients, and it's about providers. Thank you for your time today.